Everybody, that was a good one. Everybody, we are live. It is good timing. It is 30 with Karen and Justin, and the team's all here. The gang's all here. Now, it is Wednesday morning. But what happens on a Wednesday morning, or why we deviate from our normal Thursday, is when we have guests that are that good that we really want to just fit them in wherever they are available. We work around it sometimes. So we appreciate Jessica coming on. We have the founder of Epilogue. She's on a mission to help seniors and their families navigate the complex world of healthcare and social support. And she's doing it with compassion, expertise, and a whole lot of heart. Jessica, thanks for coming on the show.
Thanks so much for having me, and thank you for working from my schedule. I really do appreciate
Yeah, yeah,
it.
no, it's all good. It's all good. You know what? Like I said, when we have good people, we want to make sure we get them on because the message is more important than the time of day, quite frankly.
Absolutely. No, I really appreciate
Let's
it.
start about like what is Epilogue and what inspired you to start it?
Yeah, for sure. So I could definitely go back really far, but I'm going to try and keep it as concise as possible. So
I thought
at
you were only
Epilogue,
20.
pardon? No, I know. Absolutely. Yes. I am still very early in my career, that's for sure. But I've done a lot of different things kind of through high school since graduating. I went to university that led me to this spot. But I launched Epilogue of June of 2025. Kind of had been working on it in the background for about a year and a half at that point. I have spent time volunteering at our local hospital, working with seniors there. So, spending time doing mild exercises with them, just kind of spending some companionship time. During that, had many conversations with seniors and family members there on just kind of feeling alone, not knowing where they need to turn to next, especially when it comes to getting a new diagnosis or potentially falling down, and that's why you're in the hospital. So many reasons on kind of what the big question, what is next? Had many conversations there. After that, during that time, I went to McMaster and got my undergrad in health and society with a specialization in mental health and addiction. And that was during that time, took many classes in gerontology. So learned a lot from a systematic approach on kind of how aging looks in Canada and what our major concerns are here. During that time, I also went and got many certificates with Mohawk and Humber in thanatology, which is the study of death and dying, rehabilitation sciences, business management, goes on.
Way
But
smarter than us, Karen, I gotta say.
you know what? I like to say I'm a bit of a workaholic at my core, so I constantly am busy, which I love. So it just was really about maximizing my time and learning as much as possible in my 4 years of my undergrad. So I worked full time in business as well. I actually ran logistics for a small business here in Burlington. Loved that. Got kind of the business experience that I needed. And then I graduated and kind of didn't know what I wanted to do next, but I grew up in a very entrepreneurial family, so
You
knew
did.
that I did, yes. So grew up with that background, and I kind of went back to that time at the hospital, having those conversations, and then knew I wanted to work with seniors, which was a major shift because growing up, I wanted to work with kids. So I went to the complete opposite of the life cycle, which has been really fun getting to know people. And then I worked in retirement living. Again, just heard more conversations and concerns from seniors about they didn't know what to do next. They had so much challenge navigating even moving into retirement living. They just, yeah, didn't have anyone that they felt like they could turn to from a third party perspective, especially if they didn't have family close, just didn't want to have to depend on their kids, especially if they were working. Anyways, so many kind of challenges. And and then I went on to work in a specialized doctor's office. So heard from patients from the healthcare perspective. Again, went back to that. And again, heard those challenges. So June 2025, I launched Epilogue to kind of help address all of that. I like to say that I am almost like a personal assistant in a way for seniors and their families. I help address challenges from A to Z by planning, by putting in resources in place, by connecting them, kind of being that direct hub that seniors and their families can reach out to when it comes to navigating aging And it could be from a like a planning perspective. So like just retired, what could I be looking at in the next five, however long, or it is more immediate, like needing to move into a retirement home or navigating long-term care, whatever it may be. I am here. I'm building constantly a massive database of resources that I can connect people to. I'm always talking with people about what's out there. So yeah, the business kind of breaks down into the kind of three main areas. One is the planning aspect, so getting the resources that you need in place, helping navigate that. Then I do like more ongoing support, so checking in, appointment management,
Mhm.
just kind of seeing how things are going,
You
addressing any
you
new
help people keep
challenges.
on task with their appointments, I'm assuming as well, because I'm sure
Exactly.
there's memory issues and things you must deal with over time as well, or technology issues for that matter.
Yes, that is a
Yeah.
major part of what I do for sure.
Yeah.
I do, yeah, people often say, "Oh, do you know someone who can help me just know my iPhone?" I can
Right.
do that. I've grown up with it. I can easily pretty navigate it. If not, I will watch a quick video or Google it quickly, and I can definitely help set up kind of all that stuff. That is a major part of what I do, the technology piece. But yeah, appointment management is also massive because it's not just maintaining that appointment. It's, is there any work that you have to do beforehand, lab work, any imaging, where am I going? And then
Yeah,
also
yeah.
the transportation for people who don't drive. How am
Right.
I going to get to that appointment? So one of the boundaries in my business is I don't drive anyone, but I will guide them through the transportation arrangement. So I'll meet the senior at their home, wherever that may be, make sure they get into whatever transportation we've arrived, whether that's a taxi, a city bus, handy van, whatever that may be, darts in Hamilton. But and then I'll meet them at their appointment if they need that. I'm happy to join on the appointment to take notes, or sit in the waiting room, and then I'll make sure they get back home the exact same way.
This is actually a great feature, not just for the person that you're working with, but for the family as well.
Yes,
Because there's families that just can't be there day in and day out for their loved one, and you're there, and you can take those
exactly.
notes and provide that information back to the family.
Exactly, and honestly, that's a massive part of where I do
Mhm.
find my clients is their kids or their family members reaching out because they're managing maybe their own kids, depending on how old they are, their own full-time careers, and just they can't always take the time off work if they need to
Right.
go
Exactly.
to those
Yeah.
appointments or to do the check-ins.
Right.
And like I understand that from a personal level too. Like my grandmother lives in England, so we have to manage kind of her care from across the ocean,
Mm.
and helping her
Yeah.
with that. So yeah.
Yeah. Now, so Jessica, so when you, first of all, you get the call from the family and they want you. So
Yeah.
are you under a contract situation? Are you a time limit? Is this what happens? Talk to me about that so that our viewers
Yeah, absolutely.
understand.
Yeah, of course. So it really is customizable because everyone's situation is so different.
Yeah.
Typically, what I like to do is there's options. So simply, if someone just wants some questions, has some questions about the system and where to turn to, I'll have a 1 hour chat with them. Happy to do that. However, if more is needed, where I'm kind of stepping in more as that personal assistant type role, typically I like to get a plan in place to address whatever immediate
Yeah.
challenges there are. So, and I base that on kind of the quantity of challenges. So, my packages kind of range from like we're looking at up to 3 challenges, whether that be, say, getting meal service in place, um, what social activities are out there that seniors can go to, because that's a major part of what I
Mhm.
do as
Mhm.
well. Anyways, list goes on of challenges. Kind of
Mhm.
focus on the number of those challenges that are present in that moment. We pick a plan
Mhm.
that works best for that. That has a couple like review sessions where I follow up, check how that plan is going, and then if needed I can do that ongoing support. And the reason I save kind of I want to do that planning first is because I really want to get to know the senior that I'm working with
Yeah.
first and get what they need put in place before I do that ongoing, because honestly I meet with people for an hour and a half to do that ongoing support and it goes by so fast, because we end up chatting about what's going on challenging but also just what's going on in their life, and it becomes more of like a social call typically than it does, okay, let's tackle these specific challenges. So I like to kind of do that first. And then we can also and then I follow up on how they're going and we can adjust as needed.
Mhm. That's
Um,
fantastic. And
Thank
and
you.
and so go ahead, Justin. No.
well, I was just going to say you have a background in mental health and rehab and all these things that that are very impressive. How do you bring all of that together to work together effectively with seniors? How does that happen?
Yeah, so great question. It really is a combination of everything I've done. I have learned a lot of it comes from being on the job, to be fair, working in the doctor's office, because we collaborate with other doctors, the hospital system, and such like that. And then it partners with, okay, what type of information gets shared to retirement homes? What did I learn in the retirement home that connects back to what I know from the doctor's office? It all intertwines, because the way that I view it too is, aging, or actually any point in your life, it is such a holistic, you need a holistic approach, because your mental health makes such a difference to your physical health. If you're not feeling
Mhm.
great that day, you're probably not going to walk around that much, or you're not going to be active enough. So,
Yeah.
it's just a cycle, because if you're not active, your muscles may deteriorate, you may fall down, and then if you
Mhm.
fall down, you're back in the hospital where you're isolated. You're There could be so many negative emotions from having kind of that experience, and then maybe feeling like a burden to your family members because now you're in the hospital and they're having to visit you there, which in turn has if that is your mental health. So it is really all intertwined. And
I
then my
really feel like
education.
sorry to interrupt. I just
That's
was
okay.
going to say, I really feel like a lot of it has to do with the idea of losing autonomy,
Yeah.
right? Like I remember my grandmother at some point, she got in a car accident and went to do an eye test and a road test after that because they made her at that point. I think the laws
Yep.
changed or something, and she lost her ability to drive her car, and it drove her nuts. Like it really became a big deal for her. And so I can see how folks as they get older used to just getting up and doing whatever they want, wherever they want to go. Not being able to do that anymore must play a huge role in their mental health.
Absolutely, for sure. And especially where we live, like in Halton, having a car is pretty beneficial. Our transit system isn't super easy to navigate, and in some
Right,
cases requires people to walk a decent amount, even to get to a second bus. Like
right.
so for seniors, that can be quite challenging,
Mhm.
to navigate. Just even, especially if they've had a car since they were so young, haven't taken a bus ever, now they are feeling like they're trapped at home,
Mhm.
don't know how to navigate our transit system, and then also the approach to having to apply to like handy van and darts and all that. There's like paperwork involved with that, and that can take some time for sure. So especially if seniors don't have family members that they can depend on, it can be very isolating to suddenly lose, like you said, lose their license, now feel like they're trapped at home, which in fact, it like damages their mental health, and then their physical health, because they're moving less, they're talking to people less. It really is a cycle.
Yeah, and I totally agree with you. My mother was an absolute driver. Like she
Mhm.
wanted always to get into that car, and independence,
Yep.
total independence. And then she lost that.
Hmm.
And it was devastating for
Mhm.
her,
Yeah.
and we put her in a home, and she was totally devastated all the way around.
Yeah.
It was not, and it was time for, it was, because I was the only sibling in close to her.
Yeah.
And so it was my time. Every time I had to go and see her, I had to go and see her once a day. I had to go and see her in the hospital. And it was horrific
Yeah.
because I was always arranging all my appointments around her.
Yeah.
And so it was really, 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 if I had someone like you, I would have loved you.
Thank you.
Well, because you know what, I got to tell you something, and I'll go a little further. Is that, in the hospital, she wouldn't eat,
Hmm.
so I would take smoothies to her
Yeah.
so that she would eat,
Yeah.
and otherwise she would have just shriveled away,
Hmm.
because the nurses don't have time for that.
No, no, unfortunately not. Given where our healthcare system is, absolutely not right now. And food and nutrition is so crucial, especially when you're in the hospital and kind of recovering from something or managing something. That nutrition piece is so important. So it can definitely be scary as well when seniors aren't eating, because that has a bigger impact. They might faint. Their blood pressure is an issue. There's for sure. There's challenges.
There's all kinds of things, but it was quite an experience, Jessica, in regard to that, because, as I say, I was the only sibling. So I wonder, when I deal with people of that age, I always look around and I think, okay, so who's the advocate here? Who's going to take care of these people? And I find so many siblings struggling to do that,
Oh, for sure.
Sorry. Go ahead, Jessica.
I was just gonna say, caregiver burnout is a major issue that we're facing globally. To be fair, there is a massive need for seniors or anyone that needs care to depend on their family members, and oftentimes it does fall down to one person. At least to do the primary job.
But interestingly, even if that caregiver's in the same home, that's almost even worse in a lot of ways, because they have to deal with that on a daily basis, day in and day out. The second they wake up, there's something to do, something to take care of, something to deal with in that realm, and then they don't shut off, right?
No, for sure. It's 24/7. The job is 24/7, and I think in some cases we're coming to appreciate that role more than we ever have, but we are still very behind in acknowledging caregivers, unpaid caregiving as a job.
Yeah, you're right.
And I'm going to add another little caveat to this, because that senior is put in the position that they're put in as far as health-wise and mobility, etc. They're angry. And they get angry at their children. And if you're taking care of that person or that senior, I got to tell you that anger is lashed out to that child, and that's not a happy thing, And I don't know what you go through, Jessica. Do you get that from seniors?
It's funny. I find that I get a bit more relief from seniors because I'm that third party. It's easier for them to talk to me oftentimes, especially around death.
Bingo.
And end of life planning, because they don't want to bring it up with their kids. Their kids don't want to have to talk to it with them. So they're kind of left in this limbo of, they know eventually, as we all will die eventually, that time will come, but they're not prepared in any way. Which is what led me to actually I got a certificate in thanatology, which is study of death, dying, and bereavement, from Humber. So tying in that piece of education, because that is a major component. But I get more of the relief sense from seniors, I find, because I'm that third party. So it's easier to talk to me. They don't feel as much of a burden. And I will honestly, I'll have senior clients who come up to me when I'm out in the community at fairs and such. And they'll come up to me and they're like, this is fantastic. I don't want to have to call my kids every single time I need something.
They feel guilty in a way.
Yeah.
Right? Because they don't want to bother them, right?
And let's face it, they've had their independence for so long, and they haven't had to call those children, right? And all of a sudden, it's like, I'm alone. I don't know what to do, and I'm scared, and I'm angry, and all these.
That's a good point, though. Fear plays a big factor in a lot of this.
Oh, absolutely.
They're afraid of what the future holds, right?
Yeah.
And very interesting. Jessica, so do you get a lot of calls? I'm curious.
So I get a bit of a mixture. I am referrals are definitely starting to roll in. I've partnered with, or I've met with some fantastic individuals across kind of the aging community, I'll say. So I do get phone calls, I get emails, I meet people in the community who will hand me their phone number right then and there and say, please call me. It really is a whole mixture of different ways.
Yeah.
Well, talk to me about when families just start out, when they're planning for their aging parents. What are the first steps they should take, aside from calling you, that might help them a little bit in their planning process?
Yeah, absolutely. Again, very subjective to kind of where they are in that, because some people, they will want to start to plan as soon as they retire, which they could be ready to travel. They could be ready to enjoy retirement. But then there's also people in that age group who um, maybe are not in a maybe financial place to travel. They are physically not able to travel. So it really depends on people. However, what I would kind of recommend to family members or seniors who are looking at the next steps is really looking at what do you want to accomplish in the rest of your life? What are your goals? What would you like to do? And kind of answer some of the major questions like would you be open to moving into retirement living? Would you do you want to downsize? Are you looking for home care support? Is that something that you need? Those major questions are kind of the key questions that I think people should start with, at least to be on the same page, because there could come a day, even if you plan now. Planning is just essentially having conversations and noting stuff down, in my opinion, which I think is so important because really at any age, anything can happen. So it's important to have those conversations so you don't feel like your independence has been taken away because you had those conversations 2 years ago, 5 years ago, 10 years ago, when you said, you know what, I would be open to moving to retirement living, so that when the time does come, you can make those changes. So I think, yeah, really those main conversations. And then also a major part of it is looking at long-term care, depending on where you are in the journey, because that wait list is pretty significant. And even if you don't take the placement in a long-term care like a residence at that time, you just go back on the wait list essentially. But that is an important step because one, it lets you know kind of where you fall on the level of care that they provide from a government level. And if you can start getting home care, if that's something that you're interested in, because that's where you start. So for people who are scrambling at the last minute because they realize that they actually need 10 hours of support, a week, a day, whatever's needed, oftentimes it can take time. Again, the timelines that long-term care and retirement living, and they say this to me as well, is there is a timeline, like there's a wait list for sure, but things change constantly. So like even though it is a 2-year wait list, they may, especially retirement living, they may have a unit come up that may not be the right size for you, but it could at least get you in and then you could move.
So-
But yeah, go ahead.
So what I understand from you then, the steps are, even if you're, let's say hypothetically 70 or 75,
Yeah.
you should be planning for the future of what is going to happen to you in the future when you're 85 or 90 or 100, whatever it is, right?
Yeah, at least having those discussions and getting it noted down. Like, it doesn't have to be obviously in a legal way, but if you have someone who is in your network that you depend on for support, having those conversations of, yes, I would be open to moving to retirement living. This is what right now what I'm looking for, so that you aren't just thrown into another accommodation if you're not ready for it, essentially. So it's not necessarily planning in terms of like putting your name in on the wait list for those retirement homes per se, because retirement homes are different in the sense of there is obviously the financial aspect for sure, and their turnover happens quite fast. It can happen quite fast, and there's always other options for retirement living. But I think it's really important that at any age have those conversations about what you want, kind of the next few years. Like I even have conversations with my family, and I am 24, about what I would want what I would want at the end of my life. Because
well, I've expressed my feeling about it. So what happens when and what is the percentage of the people that want to stay in their home and say, no, I do not want to move, I do not want to go to retirement living?
I don't have an exact number, but I would say it's pretty high, based on the conversations I'm having with people.
So they want to stay there until they die.
Yeah, a lot.
And I hear that.
Most, I would
You
say,
know
from
what?
my
I
opinion.
hear that so frequently,
Yeah.
Jess.
Yes,
We
and I bet
hear
you do.
that. Yeah. I mean, but the thing is, it's such a tough fight for those children to go from A to B
Yeah.
and to get them into that retirement living. And I guess the concept of retirement living is so it's a bit scary, I guess. So it's interesting that you're involved in this. And so what is the convincing line that you use to get them into retirement living from their house? I'm sure you've been put
Honestly,
in that spot.
yeah, honestly, I don't have one line. Oftentimes because I'm a third party and like I do not represent any company, any
Yeah.
specific retirement home. By telling seniors that it's time they cannot maintain their home life anymore, they typically won't argue with me as much as they would with their kids.
Mhm.
Yeah.
Just being that step away but still there, it is a major benefit in having conversations like that.
I think people will look at you like a professional in the industry.
Exactly.
Like a medical professional in the industry. You have all these accreditations and all the things to be able to say, listen, I've looked over everything you've got here. This scenario is untenable. We need to move you to a place that gives you more support. And that's it.
Exactly.
And I'm sure you
Exactly.
handle it in a much, you're not looking at them going, it's time to move, grandpa.
No.
Like you're doing it in a much more,
No, exactly. And at that point,
Knock, knock.
yeah, no, exactly. I do not just barge in and yell at them. That does not happen. But honestly, at that point, I've also worked with them enough to kind of get whatever home
Right.
care is
You've
needed.
been there
That
for a
we've reached
while.
that point.
Yeah, you've
Yeah,
been there for a while doing other things and helping
exactly.
along, and they're
Yeah.
gaining trust with you and so on and so forth. What I
Yeah.
find most interesting about all of this, quite frankly, is this is literally the circle of life.
Yeah.
Right. Where we start out as children needing all this support, needing people to feed us, needing people to help us with things and learn things and whatever. What kind of care do they need during the day when they're out, when the parents are out, and so on and so forth, all the way around to we're having the same conversations that we're having about our children with older folks in a different way, but it feels very similar. But the children are now taking care of the parents, which I find interesting, and I love, and I think
Yeah,
it's
for sure.
it's part of the process of having family, right? I think it's very cool.
That's why we
Yeah,
have children.
Yeah, yeah, right. Yeah.
Yes, definitely is a bit of a
That's why I
benefit.
have
That's for
guests come
sure.
on like this just to push you along. Oh my goodness,
You
that's
know,
funny.
and if you don't have children, you're in trouble.
So
Yeah,
just as
there
we
definitely
come,
is a lot of concern for sure at that point. That's mainly like a lot of my clients actually are people who don't. Well, I get
right,
splits. People who don't have the family nearby, or anyone they feel like is in their corner.
sure,
Or they start depending on their friends who are also aging.
right.
Really, it's so like I've said, it's so subjective. Every single person through this journey is looking at it so differently. What they need is so different. Their support network is so different. It really is. It's fascinating.
What's the ultimate goal for Epilogue in the next few years? I love the
Ooh,
name, by the way. The name is really
thank
cool.
you,
Yeah, well, because
thank
you know
you.
what? I'll tell you right now. When you read a book and you get to the epilogue, a lot of times that epilogue is as important as the story. And that's the way I'm
Absolutely.
hearing this name of this company, which I think is
Hmm.
exactly appropriate for what you're doing.
Oh no, absolutely. Yeah. I'm a massive reader. So
Mm,
it was actually my stepdad who was on the show a while ago. He
yes,
was the one that came up with it.
amazing.
But yeah, because also in a book sense, epilogue it's not the end of the book.
No,
It's just the next step.
right.
And oftentimes it's just the continuation of the story. And there's no end to that epilogue. It's just
Sure.
like, okay, and they lived. Like, and then that's it.
Yes, right. Yes.
So yeah,
I
thank you. I
love it.
appreciate it.
Yeah.
As for goals in the next year, would love to grow. I'm working on doing something so that the services I offer are as accessible as possible to seniors, because I understand and I hear it repeatedly that a lot of seniors, they don't have the funds to pay for someone to help like in any services, but especially something when it comes down to me helping navigate with them. So that is the goal, is to figure out a way where I can support any senior that needs support,
It
regardless
sounds
of
to me like
if
you
they have
need
the
new
money or
team
not.
members too, because you can't do it all alone.
No,
That's part of the growth
exactly.
pattern.
Yes, that would
Yeah.
be lovely. I would
Yeah.
love to, yeah, for sure. Team members, I would love to expand and cover more area in Ontario, at least kind of maybe like Niagara or Barrie, go up that way. But honestly, I would love to just get the navigation services to seniors wherever they need it.
Yeah, yeah, yeah.
Last question. If you could give one piece of advice to anyone supporting an aging loved one, what would it be?
Fantastic question. I think in terms of from the caregiver perspective, treat yourself with compassion, because it is a lot to support anyone and it is a lot to navigate. So yeah, treat yourself well and be patient and give yourself compassion. Self-care is so important. That would be for the caregiver. For seniors, from that perspective, talk, discuss, ask those questions, because they are so important. And yeah, they may be hard, especially when it comes to health or end of life, but it is so important that you have those conversations now, so that when if anything was to happen, and you have to act fast, whether that is healthcare related, in the hospital, or if it is end of life, you already have the answers, so you can really focus on being there instead of being out there and planning and navigating.
So important. And it's interesting, in every relationship across your entire life, the one thing that will either make or break it is communication.
Absolutely.
And so this
100%.
only, builds that up. And what's lovely about this whole conversation as a whole, I want to tell you, Jessica, is that you've actually inspired me to have a serious conversation with my mother, who's sitting right next to us in the room, about this, because she's made some serious changes in her life. She doesn't live, where she used to live, and different things and so on. And so I'm going to be having these conversations, because it
Good.
doesn't matter how old you are, you might as well start now, is what
Absolutely. For sure. 100%.
Fine.
Yeah.
I know you're fine. See, this is the problem. Jessica, let's go. Let's start right now.
Yeah. Perfect. Sounds great.
All
Anyway,
right.
Jessica,
Anyway,
I've got to
thank you
tell
so much.
you are very, very, very enlightening, and I love
Yes. Yeah.
your
And I
position.
just wanted to make the connection here. I didn't want the whole episode to be overshadowed by the fact that your parents created a wicked book.
Thank you.
We had your parents on. No, well, we had your parents on just before Christmas, and we talked about Zuzu, the supersonic reindeer,
Yes.
and that book, and it was awesome. And what I see here is the carry on of that entrepreneurial spirit, and the idea that you've come from a family that's just like that, and that just does stuff like
Yeah.
this. It's awesome. So I can
Thank
wholly
you.
appreciate
Good.
what you're doing. I think it's always noble for people to want to help others in
Yeah.
general. And so
For
this
sure.
is a great thing. So I appreciate you. And
Thank
everyone, thanks for watching. We will see you again next week on our regularly scheduled time. And
See you
we
later.
will talk soon. Bye-bye.
Bye. Thanks so much.
Bye.